Good morning, Mr. Chairman. Can you hear me?
So we'll then move to item 4, which is consent calendar. Yeah, all the items for you work through which way?
I'll make the motion to approve as presented.
Right? And that's on.
Yeah, second.
Yes. So we have motion and second. Madam Clerk, please call it.
Jones.
Yes.
Richard Valley. Edgar Boone.
Here.
Peterson. Chip Agundis.
He is.
4 in favor, motion carries. We'll now move to regular agenda items, and that's item 5. And we'll start with an item from item A, which comes from County Council.
Good morning, Mr. Chairman and Board of Supervisors. On September 14th, 2021, your board conducted a hearing to consider Kingsview's Behavioral Health Systems appeal of the Behavioral Health Department's decision to recommend the award of RFP 2021-72 for specialty mental health services to children and youth to another bidder. At the close of the hearing, the board took the matter under submission. On September 20th, 2021, the board met to seek the advice of counsel with respect to the legal merits of Kingsview's appeal. The matter is brought back today with the recommendation that your board issue a decision that Kingsview's protest lacks merit and Behavioral Health's recommendation to award request for proposal 2021-72 to Mental Health Systems, Inc. was reached in a fair and reasonable manner and therefore will not be overturned. In the alternative, the board may decide that Kingsview's protest has merit and either all proposals received in response to the RFP must be reevaluated by individuals other than those involved in the initial evaluation, or that RFP 2021-72 is a failure, reject all proposals, and direct Behavioral Health to issue a new RFP. And I leave that for your decision and discretion.
Very good, thank you. At this point, we'll bring it back to the board for action. Board, do you have direction? Adam? I believe we had 3 options, and those were just outlined. And so with that,
And I will be clear that the recommended option was to deny the protest and accept the RFP decision made by Behavioral Health.
very good. So with that, do you wish to affirm the action that was discussed?
Make a motion to. Thank you, Joey.
Just trying to help you out.
Motion, That the protest lack merit.
Neb seconds.
Okay. Any further discussion?
Mr. Chair, good morning. I'll be abstaining due to the fact that I wasn't in attendance when this issue was brought up, the last board meeting. Thank you.
Okay. Right. With that, we have a motion and a second. And Madam Clerk, would you please call the roll?
Joe Nevs,
Yes.
Richard Valley,
Abstain?
Doug Raboon,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Yes.
Okay, we have 4 in favor and 1 abstention. The motion carries, and we'll now move to item 5A2 and 2A and B, I guess is actually.
And that would be me again. Good morning, one more time. The purpose of this item is to inform the board of AB 361 and its implications on the Board of Supervisors meetings and their ability to continue to hold teleconference meetings. Since March 2020, the board has been holding its meetings via teleconference pursuant to executive orders issued by Governor Newsom. Those executive orders expire on September 30th, 2021. However, the legislature recently passed and the governor signed into law AB 361, which will become effective on October 1st, 2021. AB 361 allows the board, upon certain conditions, to continue holding meetings under modified teleconferencing rules. Those conditions are existence of a proclaimed state of emergency and either an order or recommendation from state or local officials promoting social distancing, or a finding by the board that meeting in person would present imminent risk to the health or safety of attendees. If the board continues to hold teleconference meetings for more than 30 days under AB 361, it must additionally make findings once every 30 days that the state of emergency and the recommendation for social distancing or imminent threat of harm continue to exist. So long as those conditions exist, the board may continue to suspend the Brown Act rules that require posting the agenda and at all teleconference locations, identifying each teleconference location in the notice and agenda of the meeting, opening each teleconference location to the public, allowing the public to address the legislative body directly at each teleconference location, and having at least a quorum of the legislative body to participate from locations within the county. On September 22nd, 2021, the county's public health officer, Dr. Teskey, issued a recommendation that public bodies within Kings County retain the option to meet remotely due to the continued threat of COVID-19. Coupled with the currently existing state of emergency, his recommendation provides the board the authority it needs to continue to hold teleconference public meetings under AB 361's provisions. Unless directed otherwise, staff will proceed accordingly and bring back findings for the board's consideration as required. So at this time, if the staff's intent is to proceed with continued teleconference meetings, if the board would like to direct something differently, then we will accept that feedback and proceed accordingly.
Very good. Thank you for outlining that item. And board, bring it back to you for discussion at this point. I would say that as we are still in the throes of COVID, that this is a viable option for us to use to make access to this meeting as open and easy as possible. And with that, again, I bring it back to the board for your direction.
Comment, Mr. Chair?
Go ahead, Supervisor Brown.
Hey, thank you, Mr. Chair. Hey, Mr. Chair, I know I appreciate the availability of this option. I believe it's worked. It's worked for the last year and a half. The only issue I believe I've had is when we had 5 minutes ago when I can't hear you guys. Other than that, I think many of us have used it at least at one time, and I'm for keeping it the same without adding any changes or making anything more stringent. I like the format that we currently have, Mr. Chair, and I just wanted to add my opinion to the discussion. Thank you.
Thank you. Further discussion?
Well, I think it's a great option to have, but I also think we have a responsibility to be here in person. 21 day a week, not that big a deal, but I think we should have it available for when something occurs that we can't make it. But not abuse it.
Great.
I live in the country, so my broadband bandwidth is very weak, so it's hard to do it. To be in person.
Yep. Okay. You agree? Okay, well, just be clear, just to be clear, because that was a fairly broad statement. I've heard two statements from Supervisor Valley. I've heard from you that you're okay with it, but you would encourage people to be here at the meeting.
Right.
And so in that motion, I hear that you would like to affirm and request that we seek findings to continue.
Yes.
Okay.
I don't want to have to restrict the public just so we can have meetings online. People are doing their own thing and making their own choices day to day. They're going to concerts, they're going to football games, they're going to baseball games. We don't need that. Like, you know, their life don't mean nothing. So we can have our meetings here in public. We can do our civic duty by coming to our board meetings and doing our job and not being hypocritical and, you know, sit in seclusion while we take the weekends and we go to the races and the football games and do whatever we want to do. Either we're living our lives or we're not. So I think it's time to cut the umbilical cord and take care of ourselves, be responsible. But I still like the idea of having an option available in case somebody comes in contact with COVID, and I don't think it should be used every day. You need a doctor's note. You're gonna miss PE class, you better have a note.
Hey, Mr. Chairman, I would just add to that as that might sound humorous on the serious side, we have had a case again last year where we attended physically, I myself as well, and the next day to find out that we are all quarantined due to exposure. So I don't see how anyone could abuse the situation. Either it's allowed or it's not allowed. And if a board member takes advantage of the option to attend virtually for whatever reasons he or she may feel, I don't think that should be labeled as an abuse. We're doing it because people have died. Many people have died in our county. We're going to get another update. There's nothing funny about it. The option exists to save lives. So that should just be made clear, front and center. Thank you.
All right. So we have a motion on the floor, which I think I outlined to the approval of Supervisor Verboen. Is that correct? Or is it? Okay. Okay. We need a second. Supervisor Valley.
Mr. Chair, I'm happy to second if you just clarify. The motion is just.
Hold on. I did see Supervisor Fagundes did make a second. Is that an acceptable? The motion is acceptable as proposed. Okay.
And if I may just make sure that I understand the motion that's before, that's to affirm and seek findings, affirm the desire to continue to meet by teleconference and seek findings to allow that.
Correct.
But I don't want to be hypocritical and then, you know, be caught goofing off all weekend long or going to Disneyland or doing something and then come back and say, no, I don't want no one near me. That's what's wrong. I mean, you gotta be results, be responsible. We understand the virus is here, it may never go away, so get back to learning how to adjust our lives around it.
Okay, we have
We're going to upgrade our video conferencing and our telecommunications here in the future. So I think it's a good step for our board to go into the future with communication to people that can't make it in here.
And without any further comments?
Mr. Chairman, can you just please outline the clarification of the motion? I mean, the motion is just as presented on agenda, or is the motion built around the opinion of Supervisor Verboen?
The motion is, we're going to keep the teleconferencing, but I had a comment that we're not going to abuse it because we're hypocritical if we're spending our lives goofing off all weekend long and we refuse to come into a board meeting. We've been around other people. Unless you think you've been in contact with someone that may be positive, then I fully understand.
Okay,
Right. So with that, Madam Clerk, would you please call the roll?
Joe Nevs,
Yes.
Richard Valley,
aye.
Doug Verboen,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Yes.
Okay, we have 5 in favor. Motion carries. We'll now move to item 5B, which is Human Resources and Department. That's Henny Ring. And Henny, I understand that we do have some, there was some omissions and you would like to address that.
Yeah, there'll just be
Yeah.
one clarification on something that dropped off on the draft and it'll be presented.
Thank you.
Okay. Good morning, Chairman, members of the board. Henny Ring with Human Resources. Today's item is a salary resolution update. Periodically, the salary resolution is updated to reflect negotiated memorandum of understanding agreements with various bargaining units, classification and compensation changes, and the addition and deletion of positions. This update includes miscellaneous additions and deletions and classification activity approved by the Board of Supervisors since the last salary resolution. This update reflects various proposed salary adjustment recommendations related to a cost of living, a COLA increase, as well as one-time lump sum payment of $500 for unrepresented management, appointed and elected officials, depending on your board's direction regarding the elected official piece. Let's see, unrepresented management has not received an increase since July of 2018. The proposed salary increase for ranges approximately 4% is recommended for all unrepresented management effective September 20th, 2021, which is pay period 20. With the exception of appointed and elected officials identified in the chart that was provided in your packets. The appointed and represented management identified in the chart in your packets shall receive various salary increases based on adjustments within the various salary bands effective September 20th, 2021, which is pay period 20, which is this current pay period. Additionally, the salaries for elected officials must be discussed in open session. Pursuant to Ordinance 690, which was approved by your board on May 14th, 2019, the board set the salary and compensation as a percentage with the Superior Court judges' salaries. The state recently adopted a 4.3 increase to the salaries. The salary resolution will reflect the Board of Supervisors' newly flat rate of $6,876 and the chairperson of the Board of Supervisors receiving a new monthly flat rate of $7,653. Again, effective September 20th, pay period 20, which is now, which is consistent with the unrepresented management increases. The salary resolution will include all updated negotiated memorandum of understanding agreements that have been done so far with various bargaining groups, classification and compensation changes, and including an adjustment to the salary bands for county officials, changing from $9,000 to $18,000 monthly, and it's moving the scale up to $10,000 to $19,000 monthly. This update will also include the miscellaneous addition and deletions, like I had mentioned before, and classification activity that was previously approved by your board. Additionally, all employees in the unrepresented management, appointed and elected officials, depending on the board's direction, shall receive a lump sum of $500 effective September 20th, 2021. The salary resolution, which was attached, has all the highlighted and strikeouts, bolded, and I think that were red and underlined, and any deletions were marked out with a strike through. Additionally, with the draft that you presented, the Deputy Director of Planning was dropped off, but in the final salary resolution, it will be added, so it'll be included in the final part. Let's see, the fiscal impact. The total associated costs with the salary adjustments, including the elected official positions of assessor, clerk, recorder, district attorney, and sheriff, is $1,299,066, which was not included in the fiscal year of 2021 adopted budget. To the extent necessary, the associated salary adjustments will be applied to the respective department budgets. The impact to the general fund, excluding the mentioned of the elected officials, will be $526,488. Additionally, all employees in the unrepresented management, appointed and elected officials, assuming your board directs staff to implement it, shall receive a lump sum of $500, again, effective September 20th, 2021, with a one-time cost of $101,500, of which $48,650 would be a direct impact to general fund. Today's recommendation is, I'll read them off for you because there's several and they get kind of technical. Adopt the salary resolution which reflects the recommended and previously authorized classification, salary, benefit changes, and the adjustment of the salary bands for county officials. Approve a 4% cost of living increase for unrepresented management effective September 20th, 2021, pay period 2021. Approve various cost of living increases for appointed department heads based on salary band adjustments effective September 20th, 2021, pay period 20. Approve a one-time lump sum in the amount of $500 to all unrepresented management, and discuss and direct staff regarding a cost of living increase and a one-time lump sum in the amount of $500 for the elected officials of assessor, district attorney, and sheriff. And that is the extent of my presentation, but I'm available for any questions.
Very good. Thank you. And thank you for a lot of hard work. This has been a process and to all the bargaining groups and years. I know you've been affected. Your specific department has been affected by some challenges in staffing.
Yes, significant staffing issues right now.
And I know that it falls on the department head at the end of the day, and we should truly appreciate all of your efforts in making this happen. And with that, we'll bring it back to the board for questions, discussions.
I know. So, a year ago, we were set to do these salary negotiations. We asked that we just put everything on hold for a year because of the uncertain situation with COVID and short staff and people not being here. So I want to give thanks to all the bargaining parties for their patience and allowing us to come together and get this done. I think it's a pretty good increase. It took a little bit longer than we anticipated, but thank you for your patience. I do respect what you guys do and want to take care of our employees. I'll make a motion as presented.
Second.
Thank you, staff.
Mr. Chairman, question.
Yes, Supervisor Raleigh.
Thank you. Mr. Chairman, I see that item E specifically outlines and separates the elected officials. Does items A through D include the elected officials, or are we going to take the elected officials up separately?
It's the board's discretion to discuss. So if right now it's to just discuss it and then direct if you want to give the elected officials the set increases that I had mentioned.
Are the increases are the language is already in the salary resolution under item A?
Yeah, it was in the drafted salary resolution. Yes.
Mr. Chairman, I planned on abstaining on item E, and I'd like to abstain from increases for elected officials. But seeing as how there's already a motion on the table, if that motion stays, and that would be the only reason I'd have to vote no, even though I'm a yes on items A through D.
All right. So with that point of clarification, anyone have any further comments, thoughts, actions? Ms. Freeman?
Yes, I just want to call to the board's attention that if you want to separate the aspects of this, that you can do each item by separate motion.
Okay. So I will look to the maker of the motion. Are you good with motion?
All right, I'll make a motion to approve item B1A. That's presented.
Does that address, can maybe some clarification for
consider adopting a salary resolution with the section recommended and previously authorized clarification, salary benefit change and adjustments of salary bands for county officials. And it's too hard to separate them. Goes into all of them. I think I'm going to earlier motion. Motion to approve it, you're going to 1A to E.
Okay. That is there, so the original motion stands?
Yep.
So the original second stands. Any further discussion? Hearing none. Madam Clerk, please call the roll.
Joe Nevs,
Yes.
Richard Valley,
Abstain.
Doug Verboon,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Yes.
Okay, we have 4 in favor, 1 abstention. Q. So,
So with the, and I think you did A and B. So the next item would be C, approve the various cost of livings for the appointed department heads based on the salary adjustments effective September 20th.
so just C and D.
Yes, just
Okay.
C, and then you, I can keep going. It would be, if you want to do just C, then we can do D separately and then E separately, however you want to do it.
My motion was for A, B, C, D, and E.
Oh,
Yeah.
A, B, C, D, okay. All of them, all right,
So we're done.
that's it?
Done.
All right,
Good luck.
all right, thank you.
I would like to call it to the chairman's attention that I was recently, or I was just informed that during the public comment time, the members of the public joining online were not able to hear. And it would be my recommendation to reopen the public comment time in order to remedy that situation.
Okay. Is there any interest in the board in doing that now? Do you want to wait till the end of our agenda or just allow and
You know, with, if they're online and waiting to speak, let us know.
okay, very good. So at this time, we will move back to unscheduled appearances. Any person may directly address the board at this time on any item on the agenda or other items of interest to the public that is within subject matter jurisdiction of the board. 2 minutes are allowed for each item. So, Madam Clerk.
I believe Tal Eslick is on board and also Amanda Devine. So whoever would like to go first.
Tal, go ahead.
Actually, Chairman, I'll allow Amanda to speak first.
All right.
Thanks, Tal. Appreciate it. Good morning, Chairman and Supervisors. My name is Dr. Amanda Nugent Devine, the CEO of Kingsview. We're extremely disappointed with the board's recommendation and to reject our appeal. We will request time with Dr. Lewis, as you requested of us, and her team related to other work with Kings County Behavioral Health. We've always valued our working relationship, as we mentioned before, with the county, and will continue to always welcome feedback from both staff and this board. I ask that the Board of Supervisors direct county staff to provide as much time as possible before initiating the mental health system's contract in question. This will allow ample time to effectively transition services for our kiddos in Kings County. As you know, continuity of service is paramount for the well-being of our children. Our clients and our staff are the center of every decision we make at Kingsview. And again, we ask this board to do everything in their power to provide sufficient time to appropriately transition the services in question, even if that involves overlap with MHS, so that we can provide warm handoffs and support them in getting to know our children. Whatever that would look like, we want to make sure we set our children up for success and for the successful building of new relationships and therapeutic bonds. Thank you.
Thank you. Mr. Essex.
Chairman, Supervisors, thank you for the time this morning. Thank you for reopening the unscheduled communication. I know these things are tough with being in person and other folks being on the phone. But very quickly, reiterating a lot of what Amanda said, obviously we're disappointed with the decision today. However, with the other folks that Kingsview serves in your county, we want to make sure there's a good working relationship with Dr. Lewis and her team and this board. So we will request that time and would welcome any feedback from the Board of Supervisors and county staff. And then, as Amanda mentioned, anything within the power of the Board of Supervisors to provide sufficient time to transition these services in a way that's least impactful to the patients is paramount. So again, I know there's some flexibility with that as it relates to directing staff. And, we recognize that the appeal did not go our way today. And although we're disappointed, the focus here is the patients. And as Amanda mentioned, the continuity of service is key with many of these young people that have, challenges that devastating sort of things that have happened in their life, maybe. So that is key, and anything this board can do to encourage that among staff, a longer road to transition is key. So with that, thank you, Chairman, thank you, Supervisors, and appreciate the time this morning.
Very good, thank you. Further requests for public comment? The gentleman in the plaid shirt, I see you have your hand raised. I apologize, I don't see your name, so.
Okay, my name is Mike Kostrov. I'm the CFO at Kingsview. And again, as Tal and Amanda said, we're incredibly disappointed at the decision, but are interested, of course, in working forward to help us with this and also reconciling the board's decision. Part of the appeal spoke to the retaliation on the department's behalf. And it would be helpful for us to understand how or why that portion of the appeal was not addressed by council or by the board. Thank you.
Thank you. Right. The lady with the sweater on, possibly. See, you have your hand raised. Maybe it isn't. Maybe that's just your shirt. It's in a different position. This is a bit of a challenge, so I apologize. I don't see any further hands raised. If you are live and wish to speak, if you could raise your hand, I will grant you that time. But right, seeing no further hands raised either in the system or actually, we will sorry, do you have a comment? Nope. All right, so at this time, we'll go ahead and close. Actually, is there anyone in the audience that wishes to speak? Okay, seeing none, at this time, we'll go ahead and close public comment. And Ms. Freeman?
Yes, I do. It's been, I understand that there needs some clarification for the agenda item that Human Resources brought concerning salaries. And so I would like to request that we reopen that item so Ms. Reed can address the board and provide that clarification.
Okay, so with that, we will go ahead and close public comment. Supervisor Verboen, you had
I want to reach out to the staff and people of Kingsview that have dedicated their time and their livelihood to take care of our constituents in King County through behavioral health, and thank them for the service. This is tough to make a call like this when you transfer from one leadership to another, but you are well respected in our community, and we wish you all the best. But we have to do what we have to do, and it's good to keep people invigorated and new blood in there. And you are respected, and we do thank you for your service, and we do wish for a smooth transition, and hope things work out. So thank you.
Very good, thank you. All right, seeing no further comment, we'll move back to the
Make a mistake on anything.
item 5B. Ms. Ring.
Okay, sorry. Again, good morning, Chairman, members of the board. Henny Ring with HR. We just want to have clarification on item BE, which is discuss and direct staff regarding cost of living increase and a one-time lump sum in the amount of $500 for the elected officials for assessor, district attorney, and sheriff. And the reason why is because if you look in your salary chart, and we actually had one error in the sheriff's salary, but it was just a notation of what their current salary is. We're asking the board to whatever you want to approve. Most of appointed elected or the appointed officials receive anywhere between a 4%, some 9, some 14. increases, but we want to know what the board wants to give the electeds on the salary increases on that.
Elected is us, the DA, the sheriff, and assessor, correct?
Well, the board is already tied to the Superior Court judge, so that's the 4.3.
What's this other three?
It's the other three, yes. So we need direction on what you want to approve for
And
that.
that's A or B.
Yes, it's going to be the item E, which is discuss and direct staff regarding the cost of living for the electeds.
All right. Well, I think we need to either affirm what we've done for everyone else with the cost of living. And I think that's what you're asking for, right?
Right. So unrepresented management, which what you had given was 4% for unrepresented management. So that would be your, most likely your base on that,
And the one-time lump sum.
of $500.
Right.
So you can choose on anything in there. Again, that's why we put various, because some of the appointed officials had received various increases depending on the longevity in their respective positions and.
Okay. Okay.
Mr. Chairman?
Yes, Supervisor Raleigh.
Yeah, Mr. Chairman, I just want to reiterate, that's why I asked the question earlier. I wanted to vote yes for everything A through C, except with the exception of elected officials. I just wanted to say, even though on record I've abstained, that again, I support those cost of living increases, the salary increases for our hardworking county employees. This is a clarification I was asking for. So once again, now that you are talking about the elected officials, I'm going to abstain from the rest of the conversation and the vote. Thank you, Mr. Chairman.
Okay.
And for additional clarification, so it says employees and appointed elected officials, depending on your board's direction, again, would be the $500. So that would also include the board as well.
Well,
And-
we don't even have it all, do we?
No, it's the item E just assesses the includes the assessor, district attorney, and the sheriff. That's it.
Right. Okay with it?
Okay, is that a motion?
Yeah, I'll make a motion to approve this presented.
So for
You get the
the,
clarification?
that's for the one-time lump sum. So what about the
The
4%.
COLA? 4%?
Yeah.
Okay.
I think that was included.
Is there a motion on
Second.
that?
Yep, that's the motion.
Yeah, and that's the way I understood it the
Yeah,
first time.
right.
But I guess I appreciate the clarification because, but that's kind of what I
I'm not
voted.
involved in this. It's just that it affects everybody else.
Right.
But you have to discuss in open session, so that's.
Sure.
It's like this right here.
Yeah. Good enough. So with that, we have a motion. Is there a second?
Yeah, Nev seconds.
Okay. Madam Clerk, please call the roll.
Joe Nevs.
Yes.
Richard Valley,
Abstain?
Doug Verboon,
Yes.
Craig Peterson.
Aye.
Richard Fagundes.
Yes.
Okay, we have 4 in favor, 1 abstention.
Thank you.
Thank you.
I won't come back.
Don't make promises you can't keep. Oh, yeah. See what I mean?
All right. We've been bouncing all over. Now we hopefully are back on track here. We'll go to item 5C, which is from administration.
Thank you, Mr. Chairman. Ed Hill, County Administrative Officer. Under the provisions of the California State Association of Counties Constitution, members of the Board of Directors and alternates are nominated by their respective Board of Supervisors and appointed by the Executive Committee to a one-year term commencing with the first day of the CSAC Annual Conference scheduled to take place on Thursday, December 2nd, 2021. 2 vacancies exist on the CSAC Board of Directors to represent Kings County on this board, 1 regular member and 1 alternate for 2021. Today, we are seeking your board's appointment of a primary and alternate director to the CSAC Board of Directors. We have provided a copy of the notification to be completed upon your board's appointment for the CSAC Board of Directors. CSAC's Board of Directors and Executive Committees meet regularly throughout the year to set association's policy and direction and are pivotal in moving statewide policies and improvements matters. There is no fiscal impact associated with the selection or this action. And pursuant to board policy, the administrative office makes no recommendations on commission advisory board appointments. This concludes my report, and I'm happy to answer any questions.
Okay, very good. Thank you. Questions from the board?
Mr. Chairman, I believe currently it's you and Supervisor Verboen, with Chairman Peterson being the primary and Verboen being the alternate. You guys have done a good job up there. If you guys are willing to continue to represent the county, I'm happy to make that motion.
Very good. Thank you. Is there a second?
Yeah, I'll second that.
Okay.
I'm not carrying your books.
All right. We have a motion and a second without carrying the books. So, Madam Clerk, please call the roll.
Joe Nevs,
Yes.
Richard Valley,
Aye.
Doug Verboen,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Yes.
Okay, we have 5 in favor. Motion carries. We'll now move to item 5D, which is Public Health Department. And Ms. Heather Civil, welcome.
Good morning, Chairman and members of the board. Heather Silva with Public Health. I would like to start my report off, as we always do, by reminding everyone of the simple steps we can all take to protect ourselves from communicable disease such as COVID-19. Frequently wash your hands for 20 seconds or more. Do not touch your face with unwashed hands. Stay hydrated with water. A hydrated cell is a healthy cell. Stay home if you are sick. Wear a face mask to protect those most vulnerable and unvaccinated around you. Get vaccinated. In addition to the COVID vaccines, we encourage everyone to get a flu vaccine as soon as you're able to. Also, as a reminder, our daily numbers are available on our website. We continue to have ongoing communication with the hospital on their resource request and daily status. Regionally, hospital admissions in med-surg and ICU remain high and are putting a strain on the hospital system, including here in our local hospital. As of September 27th, our local hospital had 53 patients in med-surg and 11 patients in the ICU. Of those admitted, 35 are Kings County residents. Since July 1st, the unvaccinated COVID patients have accounted for 89% of admissions, and 11% of those hospitalized have been vaccinated. Last Friday, September 24th, Adventist Health requested 9 registered nurses, 4 for the ICU and 4 for the ER, or emergency room department. The state responded with an allocation of 4 RNs, 2 for ICU and 2 for the emergency room. Central California Emergency Medical Services Agency, also referred to as IMSA, assess and refer policy remains in place for Kings, Tulare, Fresno, and Madera counties by directing paramedics and EMTs to refer patients to urgent care for their private provider if after a full assessment, the patient exhibits no emergent conditions that would require immediate transport to the emergency room. Our PPE status has not changed, and we are still maintaining a 60-day supply of PPE for our healthcare facilities. The mobile testing site schedule for this week is on our website, and testing demand remains high, but has decreased in the past week and is at approximately 2,300 tests. We remain committed to keeping testing readily available throughout the county, particularly in areas where healthcare access is a barrier. We continue to work with Kings County Office of Ed to encourage schools to offer testing on site, as the state has prioritized rapid tests for the K-12 population. We currently use the Valencia branch lab through the state to process our COVID-19 tests. The state sent out information last week stating they are backlogged in reporting out test results, which has caused us to experience longer turnaround times for our COVID-19 tests. The turnaround time is now anywhere between 3 to 5 days. With that being said, we highly encourage those that are testing due to symptoms and exposure to remain at home until they receive the results in order to avoid further transmission of the virus. We had 411 new cases last week, a decrease from the 2 weeks prior, bringing our new case count since the start of the current surge to 5,444 new cases. In the past week, we have seen a slight increase in cases among the 16 to 19 population, as well as the 65 and older age group, while we have seen a slight decrease in the 0 to 11 population for the first time in 2 months. Our Delta variant case count has increased to 212, which is a significant increase from the last week due to the state catching up with identifying variant cases. Currently, there are 67,116 reported cases of the Delta variant in California. Last week, Public Health administered 406 vaccines, which is just slightly higher than the last week. The health department continues to administer the additional 3rd dose vaccine for the immunocompromised individuals who received the Moderna or Pfizer vaccines, and we continue to have appointments and walk-ins available. This past Sunday, September 26th, Our health department began administering the booster doses for eligible individuals who received the Pfizer vaccine at least 6 months ago and fall into one of the eligible categories. Those categories are people 65 and older, people living in a long-term care facility, people 18 and older with underlying health conditions, people who are at high risk of COVID-19 exposure and transmission due to occupational or institutional settings. The Moderna and Johnson & Johnson booster shots are still under review, and the data should be available in the coming weeks. The health department has vaccine available and has been actively preparing to increase staffing in clinics specifically in the event that booster demand increases patient volume, which we do expect. We continue to add pop-up and mobile vaccine locations as staffing allows, with events already booked into October. So far, Kings County providers have administered 111,377 vaccines to county residents. The number of partially vaccinated Kings County residents is 9,545, and the number of fully vaccinated Kings County residents is 51,543. Our current breakthrough rate is at 1.3% of our vaccinated population, indicating the vaccine remains highly effective. We continue to see the evidence that vaccine is safe, effective, and widely available in Kings County, so please consider helping to protect your friends, your neighbors, and loved ones from COVID-19. Our department will do all that we can in building a community that is safer and more secure against the virus, and will continue assisting healthcare providers in meeting the demand for COVID-19 related activities. Our approach will continue to be layered, including but not limited to vaccination, testing, and encouraging those everyday measures that can make a significant difference, such as hand hygiene, masking, and isolating when you are sick. This concludes my report, and I'm happy to answer any questions.
Thank you. Questions from the board?
No, just one comment I'd like to get on record. I know that we've had people contact us about the third dose, and we need to know that the third dose is only available for Pfizer and for Johnson & Johnson. So a lot of them are a little misunderstanding. I know earlier that the media reported that you could mix them early on, but they don't recommend you mix them on the third dose, correct?
You can, I know Darcy can correct me if I'm wrong, but for the third dose additional shot for the 28 days after the second dose for the immunocompromised, those are interchangeable. So you can do Pfizer or Moderna.
But not the third dose.
No, not the third dose, no. It's just Pfizer, correct. Darcy can come up too.
So it's a little confusing. Good morning, supervisors. So for immunocompromised individuals, they recommend a 3-dose primary series. So the third dose in that case can be either Moderna or Pfizer. When it comes to the booster, which is for, another subset of the population, not including the immunocompromised, that booster comes 6 months after your 2-dose primary series. So it also is technically a third dose, but it's a different type of third dose, right? And that only is available for Pfizer.
But you can get a third dose of Moderna, but it's not considered a booster.
Correct.
For the immunocompromised, correct.
Yes.
It's a little confusing.
So for immunocompromised individuals, that third dose is part of their primary series. They need that third dose in their primary series to be able to obtain a similar amount of protection as the general public would get with 2 doses, where the booster is to maintain protection over a longer term. Okay, so that third dose kind of serves a different purpose.
They go another 6 months, and then when the booster comes out, they get the booster.
Correct. So that booster, Pfizer has been approved for the booster. Both Moderna and Pfizer have been approved for the additional dose in the immunocompromised population.
Then I guess the direction with J&J is the second dose will be considered the booster, but it'll be a full dose.
We don't know yet. So we're still waiting to see on that one. The additional dose or the booster, neither are available for Janssen just yet, or Johnson & Johnson.
And how about how does seasonal flu feed into all of the initial COVID and boosters and all of the other stuff?
So flu shots are available now. We'll be sending you some information a little bit later today around our mobile flu clinics. You can get the flu and the COVID vaccine at the same time. So we're offering those side by side in our mobile clinics whenever we can. We can't do it for everyone, but we are doing it for several this year. And you can get those together.
Are you going to be here Monday with that in the parking lot?
We are not going to be here Monday. We have flu vaccine available in the clinic at the health department clinic across the street 5 days a week now. But as far as the mobile schedule, we will be at the Cotton Festival this weekend. We'll be in Avenal next week, Lemoore a couple weeks after that. So we'll make sure that schedule gets out later today.
Thank you.
Thank you.
Thank you, Darcy. She's our vaccine expert.
Any further questions from the board? Right. Thank you.
Thank you.
Mr. Chairman, I'd like to go ahead and provide the update as we've been doing on the county employee status. Since the new surge began, had a total of 115 employees with currently approximately 30 to 40 teleworking or isolating, which is lower, considerably lower than it was last week. So that's a good sign.
Very good. Thank you. All right. Thank you for that. At this time, we'll move to item 6, which is board member announcements and reports. Supervisor Boone.
Last week had a kind of quiet week. On Friday, I had my meeting with Amtrak Dental team, discussed budget and bus routes and train station studies here in Hanford. And went to the Casa dinner on Saturday night, which was done. Very nice job. Also, Supervisor Deb's there, Supervisor Peterson there. All I got to report.
Very good. Thank you. Supervisor Forkins.
Good.
Supervisor Neves.
Thank you, Mr. Chair. Yeah, a couple of webinars. First one was dealing with the California Health Survey data, and it was kind of interesting to hear all of the health plans across California pretty much encounter the same COVID-related issues, outreach, access to care, and transportation issues. So nothing really eye-opening for that. And then the other webinar was dealing with California water markets, put on by the Public Policy Institute of California. A couple of districts have been in the water marketing arena for a couple of decades, like Mojave Water Agency. And they're an unadjudicated district. They've done it with willing buyers and willing sellers. And the only bad thing is that under that scenario, a lot of the lower priced crops can't afford the higher priced water. And so what they have seen is a loss of alfalfa in the Mojave area and a lot more cannabis. And so the higher priced crops are the only ones that are able to afford the higher priced water. And so just a kind of a discussion on that as well. The American Legion breakfast continues to happen on Friday mornings. Continue to announce that freshman football games and JV, and I'm in the press box, so I'm not really down with anybody. And then we shoot the cannon for the varsity, and nobody wants to be around us when we do that. So we've kind of been separated. Continue on Sunday, we had the Gold Star and Fallen Heroes ceremony. Very well attended by families in the community, over 100 people in attendance. A special thanks to American Legion Post 100, as well as the city of Lemoore Fire, Lemoore Police, Lemoore Naval Air Station. County fire personnel were there not only to assist with the flag, but also help with the medical aid. And Lemoore NJROTC, as well as the Legion bike riders were there. And it was a nice evening. 2:00 in the afternoon. It was a little warm, but it was nice for everyone. Housing Authority meeting yesterday went well. The Kings County Behavioral Health meeting yesterday also outlined several projects and a couple of goals to complete 2021, which includes replacing the chair who's been there way too long. And so we'll get a new chair starting for 2022 and wrap up the digital workbooks. And then last night, the Kings County Historical Society had their first meeting in about 18 months. Haley and John Waddle were there, and they discussed, and they were also at the 130th anniversary of the city of Hanford. They have come up with a way to preserve books in a digital format, and they've built this digital scanner, and it works out very well for scrapbooks and larger books. It takes in a lot larger book than the traditional books. We also had an update. A multicultural theater company has moved into the church building. and putting on plays. And just a heads up, they are planning to produce a Muscle Slough tragedy play that will take place in the spring, which would be kind of nice around May when
Never seen it hanging.
no hangings at that was just a shooting. Yeah, no hangings at the Muscle Slough tragedy, just to, and so that's up for the spring, and it would be kind of nice to happen around May for when the event happened. And then they're also planning a Grangeville cemetery tour. And so Lemoore, I was unfortunately unable to attend it this past Saturday. But Lemoore has put on a cemetery tour through Ceremony Museum, and I've been to a couple in Tulare County. And they're very interesting when they take people that are interned in the cemetery and have people portray them and offer up some real life stories about that individual. I would have been kind of nice because Folk Lee was one of them that was highlighted on this past Saturday, and Mr. Lee was the one. He started out with a Chinese restaurant in Stratford, and then he ended up going to Lemoore and creating Lincoln Market and creating the store in Lemoore. So that one I would have kind of liked to listen to, but hopefully they recorded it and I can catch it later. But with that, thank you very much, Mr. Chair.
Yeah, thank you. Supervisor Rowley.
Yeah, Mr. Chair. No, I'd just like for the record that I am virtually attending today's board meeting from my home in Corcoran. And the only reason I don't have my camera on is because I'm dealing with a home repair issue right now. Thank you, Mr. Chairman.
Thank you. For me, did a couple calls this last week. One fairly significant announcement by USDA, and just want to inform all of our public NGOs and others through USDA $700 million grant that looks back at the COVID impacts and is providing some funding for farm workers, essential meat processing facilities, and also a grocery store worker pilot program. We did ask, the cumbersomeness of the way the CARES Act kind of rolled out, and we asked why counties might not have been a part of this, because it's not just NGOs, it's also state agencies as well that can apply for this funding, and the challenges that we went through with the CARES Act funding, and one, getting it, but two, we had some pretty dynamic systems to get this money to people, and we just have a better connection, I think, than state agencies do in dispersing, this kind of funding. But so with that, I just wanted to inform, any NGO or quasi, I think, government agency that this funding is available, and obviously they outlined all of their audit processes that they will be requiring, but pretty healthy chunk of funding that's available for that. The other discussion was around the Waters of the U.S. challenge that we faced. The Trump administration, dealt with that issue. The courts overturned it, so we're back again. And for our irrigation districts, farmers in the area, this is a big challenge. The time for testimony is open currently, and you can go to the government sites to provide that testimony. But this is a critical issue when the federal government starts claiming irrigation ditches as waters of the U.S. and all the impacts that come along with that. Endangered Species Act, just to name a few. But anyways, that is out there, and the American Farm Bureau was the folks that did the call, and so our local Farm Bureau should have that information as well. But again, before this thing gets out of hand, we need to make sure that we're providing testimony with respect to that issue. And so with that, that's all I have. We'll move now to
Got one more.
oh, sorry about that. Yep.
So on October 9th, on the 17 Amtrak trains, they'll hold a special event for the rededication of Allensworth, and they'll have special trains and a discounted price for anybody who'd like to attend that. So, in the history of Allensworth, which is south of King County a little bit. October 9th is it, and go to your Amtrak website to reserve your tickets.
Thank you. Okay, so at this point, we'll go to item 6, and that's board member correspondence.
Thank you, Mr. Chairman. Ed Hill, County Administrative Officer. For board correspondence, we have 2 items from the Department of Fish and Game, a notice of proposed changes in regulations concerning the experimental fishing permit program, phase 1, a notice of final consideration of the petition to list Pacific leatherback sea turtles as an endangered species. For upcoming meetings and events, we have the links for Life Pink Passion Picnic at the Hanford Civic Auditorium, October 20th, 2021 at 10:30. We also have the United Cerebral Palsy Central California inaugural cornhole tournament at Hanford Civic Auditorium, October 24th from 10 a.m. to 11 a.m. For upcoming agenda items, admin has 2 items, the CDCR SB 81 standard agreement and an agreement with Varner for capital project management services. County Council has appointments to Angola, sorry, I'm probably butchering that name, and Green Valley Water Districts. Community Development Agency has a monthly report of Planning Commission actions. The Department of Finance has workstation purchase and reconfiguration item. Health has 4 items, the California Equitable Recovery Grant, Crisis Response and Workforce Development Funding Allocation, and ACE's Aware Initiative, and the COVID-19 update. Human Services Agent has an agreement with the SpareNet Incorporated for Transitional Housing Program Plus services. And Public Works has a lease with the United States Department of Agricultural Farm Service Agency for agricultural building space. That's all I have for board's correspondence, meetings, events, and upcoming agenda items.
Angiola.
I'm sorry?
Angiola.
Thank you.
Close. Close.
All right. Thank you for that. We'll move to item 7, which is closed session. We have numerous items in closed session today. First is Personal Matter Government Code Section 54957, County Council. And again, next is 54957, Director of Finance. And then finally, under the same number, the Director of Public Health. We do have one case, significant exposure to litigation, Government Code Section 54956.9 D1. And an additional significant exposure to litigation, one case, Government Code Section 54956.9 D2 E3. That's it for closed session items. And then at 11 o'clock, we have the California Community Housing Agency regular meeting. And at 11:15, we have the M Home Supportive Services Public Authority regular meeting. And after that, we will adjourn to the Tuesday, October 5th, 2021, regular meeting. So is there any further information to come before the meeting at this time? Seeing none, we will move to closed session. Meeting adjourned.
Hey, can you guys hear me?
Yes.
Okay. Are they in a closed session?
We're just finishing up, starting up the couch meeting.
Yeah, we just finished the couch meeting. Just
It's
kidding.
just now 11.
No.
Are you guys messing with me?
Yes.
Okay, good. Because I missed the last one by accident. Hey, don't do that to me.
All right. Let's see. Are we online? Supervisor Valley's not there yet. Okay. That's all right. Let's just go ahead and go. Right. Today is Tuesday, September 28th, 2021, and this is a regularly scheduled meeting of the California Community Housing Agency. Madam Clerk, would you please call the roll?
Here.
Joan Ebbs,
Here.
Richard Valley,
Here.
Doug Verboon,
Here.
Craig Peterson,
Here.
Richard Fagundes.
Here.
Okay, we have 5 present. Move to item 2, which is approval of the minutes from the August 31st, 2021 regular meeting.
Second.
All right, we have a motion and a second. Madam Clerk, please call the roll.
Joan Ebbs,
Yes.
Richard Valley,
Aye.
Doug Verboon,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Okay, we have 5 in favor. Motion carries. We'll move now to new business, which is item 3A. And Scott, you want to outline that for us?
Yeah, guys, this is the for our Annandale project. This is our first deal that we did way back in early 2019. You guys have seen in the past, we've approached you guys with adding some additional funds into the project. We have a debt service payment coming up in October. Just so you guys are aware, this project is finally starting to do great. It's starting to stabilize. We are also in the process of refinancing this transaction. We're not there just yet, but again, when we originally did this transaction, we were at about 5% interest rate. And with the fires and, with COVID and the evictions and, all the stuff that we couldn't really, properly do at the project to kind of, keep it in good light. So we've been having to put extra money into it. So Catalyst Housing is going to put an extra $1 million into the project right now so we can make the debt service payment on time in October. And then obviously we are looking to refinance this transaction because, we can basically go from 5% down to 3%, which is definitely going to help for the long term for this project. So that's why we're before you guys today. Again, this is Catalyst Housing going to put some more money into the project at Annandale. And then again, in the future here, we are going to refinance this. And then we should be completely good to go in Santa Rosa. So that's all I got. And I can take questions if you guys have any.
I do have one, Scott. There are opportunities to backfill rent, through the federal government now. That's available to us. Are we using that opportunity?
We looked into that. So thanks for the question. As you can imagine, when you're dealing with the federal government, there's a lot of hoops and ladders and then just timing. And we got the vibe that we weren't going to have anything in place in time to make the debt service payment, which was in October. So We decided to kind of abort on that because of just timing constraints and how long you got to wait to kind of get your approvals and everything. So we think this will be the last time that we're going to have to inject any sort of funds into the project. And then once we refinance it, we should be pretty much good to go from there.
Okay, just one last question with respect to the not to exceed $1 million. And I think you said this already, but could you repeat it again? What is the total debt on the property?
Yeah, the payment is probably going to be around 972,000 or so. But again, we just wanted to make sure that's a not to exceed amount of $1 million. But again, it's going to be less than that. But we think it's kind of around it's around 972.
Okay, that's the current debt payment, but the total incurred cost of the property,
Correct.
that is the total?
Yes.
Okay, all right. So with that, you've heard the outline.
I'll make a motion to approve the outline.
Deb seconds.
Okay, we have a motion and a second. Madam Clerk, please call roll.
Joe Nevs.
Yes.
Richard Valley.
Aye.
Deborah Boone.
Yes.
Craig Peterson.
Aye.
Richard Fagundes.
Yes.
Okay, we have 5 in favor. Motion carries. We'll now move to item 4, which is public comment. Any person may directly address this board. This time on any item on the agenda or other items of interest to the public that is within the subject matter jurisdiction of the board. 5 minutes are allowed for each item. I don't see any online questions. Do we have anyone that wishes to speak? Seeing none, we will go ahead and close public comment this time and move to item 5, which is staff updates. Scott, do you have anything for us?
We are hopeful to be back before you guys on a transaction in Corte Madera. And then we also have a buyer interview on a deal in Campbell. So hopefully we'll have some more opportunities here before the year closes up.
All right. Thank you for that. All right, we've reached item 6, which is adjournment. So before I do that, any further information coming from the board at this time? Seeing none, meeting adjourned.
Thanks, everyone.
Thank you. Right. It's 11:15. This is time and place for the Kings County In-Home Supportive Services Public Authority meeting. Madam Clerk, would you please call the roll?
Joe Nevs.
Here.
Richard Valley.
Here.
Doug Verboon.
Here.
Craig Peterson.
Here.
Richard Fagundes.
Here.
Okay, we have 5 in favor. We are 5 that are attending. Move to item 2, unscheduled appearances. Any person may directly address this board at this time on any items on the agenda or other items of interest to the public that is within the subject matter jurisdiction of the board. 5 minutes are allowed for each item. I don't see any public comment on the board. Any internal chamber? Seeing none, we'll close public comment and move to, or unscheduled appearances, and move to item 3, which is 3A is approval of the minutes from the June 22nd, 2021 meeting. Board, what's your pleasure?
So moved.
Okay, we have a motion and a second. Madam Clerk, please call the roll.
Joe Nevs.
Yes.
Richard Valley.
Aye.
Doug Verboon.
Yes.
Craig Peterson.
Aye.
Richard Fagundes.
Okay, we have 5 in favor. Motion carries. We'll now move to item 3B, which is staff announcements and brief reports on activities of the in-home supportive services.
Good morning, Board. Sonia Bugay, Public Authority Executive Director. So I want to share 2 pieces of legislation that just passed in the state budget that we don't have full impacts of yet, but would impact our operations. So one is long-term career pathways and provider training. State passed legislation to offer provider training to our IHSS providers and some short-term and long-term trainings that would both be paid once they're completed with stipends, but also paid for hours spent in training. There's a lot of kind of implementation details that are still missing when it comes to who's going to administer this. Only $200,000 was approved statewide for administration. We believe at this point that this is going to be something that's statewide administered, not administered by public authorities. However, for the training and paid hours, that is, in order for the providers to be paid, that needs to make it to our CMIP system. So there will be some impact to the counties. We're still sorting through with the state and other stakeholders. What does that really look like? One thing that we know cost-wise is the cost of the training in these stipends isn't impacting our actual cost and MOE. But everything else is, will be coming our way in the next few months. So that's piece 1. Piece 2 is emergency provider backup system. So during the past 2 years, starting with, really since the emergency started with COVID, we have state passed legislation where we've had emergency backup providers, where providers who were, who fell in this particular narrow group would get additional $2 per hour. We established a provider group that was willing to serve people that were significantly impacted by COVID and receive that $2 stipend. We had 25 providers on the backup system, went down to 15, but we did not have to access it. This legislation that was just passed got extended through December of this year. However, in addition to that, state passed legislation to set up a kind of a long-term, non-COVID related emergency backup provider system. What that will really look like, we do not know yet. There's a lot of details that are missing. My understanding is whatever the access cost is, it's still going to be within the state coverage, but the impact to our staff when it comes to entering hours, tracking it, we're still working on. That potentially has some workload impact. So I wanted to give you a heads up. Cost-wise, it does not look that the cost of actual hours would impact us at all at this point in time. And then the last thing I want to share is we're in our 3rd year of annual state audits, and we had the best one yet, despite the fact that really had some staffing challenges due to COVID. And we got a certificate from the state on the 97% of our cases were renewed timely. And while most of the Central Valley is actually really struggling with both renewals and initial applications, our staff had done really incredibly well in this area. So I want to say kudos to them and share that with you. And that's all on staff updates.
Very good. Thank you. Good to hear. All right. So with that, we'll move to item 4, which is member announcements and reports. Do we have any board members that have any reports? Seeing none, we'll move to item 5, which is closed session. And today we have one item, which is confer with labor negotiator, meet and confer under Government Code Section 54957.6. So with that, at this time, we'll move to closed session. But before I do that, any further items to come before the board this time? Very good. We will move to closed session and followed by adjournment. Thank you.
Mr. Chair, can I get a link for that closed session?